Oh, okay. Hi, everyone. Good afternoon. Welcome to the Health and Social Services Subcommittee Decision Day. We're super excited to have you all here joined us. We know that for many of you, the big show is actually related to the DDA budget. And so I want to just make super clear that much of the decisions that we make today are subcommittee level decisions, and the DDA portion is going to be at full committee in the BRFA discussion. So if you're here only for DDA, thank you for being here. We welcome you to stay as long as you wish. There might be some provisions in here related to like reports or other things, but the bulk of the DDA actions are going to be in the BRFA discussion at full committee. So just putting that out there. Thank you again for everyone for joining us. We're going to go ahead and begin, and I'll turn to our DLS analyst, Victoria, who's been an amazing, amazing partner this session. Thank you for all of your hard work. We will, as we are getting ready, and members and friends in the audience are quietly picking up their packets, we will just pause for 30 seconds, and then as again, you all are quietly picking up your packets, we'll begin in just a few seconds going through. Delegate, okay, all of our delegates are present. And again, thank you for your quiet picking up of the packets. Let's go ahead and begin, Ms. Martinez.
So just to introduce
There we go. Go ahead.
Thank you. Just to introduce the packets that you all have in front of you, this white packet is the decision document, so we're going to be going in page order. These have all of the DLS recommended actions, and then you also have a blue packet that are additional pages for your consideration. Again, as you mentioned, all of the BRFA-related items will be voted on in the full committee, so those are not included in these packets. So we're going to just go ahead and start by page order. So starting on page 1 of the decision document with our analyst, Natalie.
One moment, please. There you go.
Okay.
Yes.
Okay, perfect. Good afternoon. Page 1 of the decision document for the Office of the Deaf and Hard of Hearing, the last recommendation is to concur with governor's allowance, and the agency concurs.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Page 2 for the Department of Disabilities, the last recommendation is to concur with governor's allowance, and the agency concurs.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 3 of the analysis with the Department of Aging, the DLS recommendation is to reduce funds for the senior care program by $2.5 million in fiscal 2025 to more closely align with actual spending. The agency disagreed, and based on updated data, DLS would recommend modifying to only reduce $900,000 instead of $2.5 million.
Thank you. Move to modify to only reduce $900,000.
Second.
All in favor?
Aye.
Thank you.
On page 4 for Maryland Commission on Civil Rights, the DLS recommendation is to adopt committee narrative requesting a report on the impact of new positions on case assignment and backlog management. The agency concurs.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 6, in the Maryland Institute for Emergency Medical Services System, DLS recommended concurring with the governor's allowance, and the agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 7 for the Maryland Health Benefit Exchange, the first recommendation is to reduce funding relating to new positions, since these positions were funded in fiscal 2025 with existing resources, and the agency concurred in part.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
The second recommendation, also on page 7, is narrative requesting an annual report on the reinsurance program. The agency did not provide a response.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
The third recommendation is to add language that makes a portion of the funding for the young adult subsidy program contingent on legislation that extends the program. The agency concurred in part.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 8, starting with the Maryland Department of Health Administration, DLS recommended adopting committee narrative to request a report on bed capacity and patient length of stay at Clifton T. Perkins Hospital Center, and the agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
And then turning to your blue packet, on page 1, under the Maryland Office of the Inspector General for Health, DLS is recommending deleting 4 new positions that were added in the supplemental budget due to the availability of vacant positions elsewhere in the executive department.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 10, in the Office of Healthcare Quality, the DLS recommendation is to concur with the governor's allowance, and the agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 11, in the Health Professional Boards and Commissions, the DLS recommendation is to reduce special funds in the Board of Nursing to address a technical error, and the agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 12, in the Public Health Administration, DLS recommends restricting funding pending submission of the fiscal 2027 budget, separating local health department funding by grant and salary expenses.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thanks.
Second recommendation on that page is to reduce general funds for the core public health services, and the agency disagreed.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 13, in the Prevention and Health Promotion Administration, DLS recommended reducing funding to meet the mandated level. The agency disagreed.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 14, the first recommendation was to restrict funding pending the submission of 3 reports on provider reimbursements. The agency concurred in part, recommending changing the way the data was submitted.
Thank you. Move to modify to change how the information is submitted.
Second.
All in favor?
Aye.
Thank you.
On pages 14, 15, and 16, there's 4 pieces of annual language that authorize the agency to transfer funding between the 3 provider reimbursement programs in BHA and a reimbursement program in Medicaid. The agency disagreed.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 15, there's a recommendation from DLS to reduce the general fund appropriation for $9.9 million, and the agency disagreed. I'm also going to turn your attention to an item on page 2 of the blue packet, which modifies this recommendation to reduce instead $6.9 million and add budget bill language that restricts $3 million for spending on pediatric hospital overstays.
Thank you. Move to modify to reduce $6.9 million.
Second.
All in favor?
Aye.
I'm sorry, I know we usually just power through these, but I have to pause to just explain how big of a deal this one is, right? Pediatric hospital overstays has been a massive, massive issue for the state for a really long time, and this is going to make some very meaningful progress, and it's in large part due to the leadership of Chair Pena-Melnick. So I just needed to pause to acknowledge that. Thank you.
Turning back to the decision document, page 15, the 5th recommendation was to delete the appropriation for the 1% provider rate increase. The agency did not respond to the recommendation.
Move to reject.
Second.
All in favor?
Aye.
Thank you.
Moving to page 17 of the decision document, Recommendation 10 is to reduce funding in the Community Service for Medicaid State Fund Recipients Program due to a projected surplus in fiscal 2025, and the agency disagreed.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Moving back to the blue packet, on page 3, there's a recommendation for your consideration under BHA to add budget bill language restricting funding to support public institutions of higher education to provide drug detection products to students.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
We're going to stay in the blue packet for a few more items. So on page 4 and 5, there's a recommendation to adopt narrative requesting a study on the cost savings associated with implementing certified community behavioral health clinics.
4 and 5, move to adopt.
Second.
All in favor?
Aye.
Thank you. Sorry?
Yeah, just make
Oh, yes, of course.
Thank you, Madam Chair. And this was a topic that was obviously something I kind of cling to. I'm glad that we were able to, with the help of our analysts, come up with wonderful language so that we can try and take advantage of this program in the future and really get a strong understanding of the cost savings that these programs present to our state, and especially in Baltimore City and Cecil County and all over the place in our state. So thank you very much, Madam Chair, for allowing me to work with our analysts to get this done. And we look forward to revisiting this in further sessions.
Thank you, Delegate. Thank you for your leadership.
Thank you.
Okay.
On page 6 of the blue packet, there's a recommendation to adopt committee narrative to request a report on the spending invested in addressing pediatric hospital overstays.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
And finally, on page 7, there's a DLS recommendation, which is a technical correction to a supplemental amendment that clarifies a provision in the BRFA relating to the authorized use of opioid restitution funds.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 18 with the Developmental Disabilities Administration, the first recommendation is to add language restricting funds pending fiscal closeout report and budget amendments. The agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Okay. I think we've got a couple ayes.
On page 19, the second recommendation is to add language restricting funds pending the resolution of repeat audit findings. The agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 20, the third recommendation is to add language restricting funds pending quarterly reports on community services spending data. The agency concurred but requests an additional 2-week delay for the submission of each report.
Thank you. Modify to delay all due dates by 2 weeks.
Second.
All in favor?
Aye.
Thank you.
The fourth recommendation on page 21 is to add language restricting funding in the community services program to that use only. The agency disagrees.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 22, the fifth recommendation is to delete funding for the 1% provider rate increase. The agency did not provide a response.
Move to reject.
Second.
All in favor?
Aye.
Thank you.
And then I'm going to turn to the blue packet on page 8. There's an additional DLS recommendation. So this recommendation makes a technical change to Amendment 4 in the supplemental budget to correct line references.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
The decision document, this page 23 begins items related to the Medicaid budget. This first action is a recommendation for annual language restricting Medicaid funds to that purpose, but it allows transfer for behavioral health spending. MDH disagreed.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
The next item on page 23 is a recommendation to reduce funds for the Population Health Incentive Program to provide up to 0.25% of MCO capitated rates. $11 million of this reduction was taken in the first supplemental budget. And the agency disagreed with the amount in the DLS recommendation.
Thank you. Move to modify to reduce the difference from the supplemental.
Second.
All in favor?
Aye.
Thank you.
Item 4 on that page is a DLS recommendation to reduce funds to set MCO rates at the lowest actuarially sound level. Based on updated information from the agency, the DLS revised recommendation would be to reduce $25.1 million in total funds for the MCO rates.
Thank you. Move to modify to the revised reduction.
Second.
All in favor?
Aye.
Thank you.
Item 5 on that page is a recommendation to reduce the 1% provider rate increase for long-term care providers, and MDH acknowledged the recommendation.
Thank you. Move to reject.
Second.
All in favor?
Aye.
Thank you.
On page 24, item 7, DLS recommends reducing the enhancement for physician evaluation and management rates to instead level fund them. The agency disagreed.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Item 8, DLS recommends reducing funds for the Assistance in Community Integration Services Housing Support Program. MDH disagreed.
Thank you. Move to reject.
Second.
All in favor? Thank you.
Item 9, DLS recommends reducing funds as a technical correction for the Health Home Program. And so this action was actually decreased in the supplemental budget. And so DLS would instead recommend you reject this item.
Thank you. Move to reject.
Second.
All in favor?
Aye.
Thank you.
Item 10, DLS recommends reducing home and community-based service provider rates by 2% due to federal support expiring, and the agency disagrees.
Thank you. Move to reject.
Second.
All in favor?
Aye.
Thank you.
Item 11, DLS recommends reducing funds under Medicaid due to lower enrollment expectations, and the agency disagrees.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 25, DLS recommends narrative requesting continued reporting on the Community First Choice and Community Options programs.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 26, item 13, DLS recommends a narrative requesting quarterly reports on Medicaid enrollment.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On the next page, item 14, this would be narrative requesting status updates on primary care initiatives, and the agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 28, item 15 is also annual language restricting funds for the Maryland Children's Health Program to that purpose. MDH disagreed.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 29, item 16, DLS recommends reducing funds based on lower healthy babies enrollment. The supplemental budget reduces $14.7 million, and so DLS would revise this recommendation to reduce the $28 million difference.
Thank you. Move to modify to reduce the difference from the supplemental.
Second.
All in favor?
Aye.
Thank you.
And then item 17, DLS recommends deleting 13 long-term vacant positions. Again, the supplemental transfers 5 of these positions, and so we would recommend instead that you delete the remaining 8 positions and the associated funding.
Thank you. A move to modify to reduce remaining 8 positions.
Second.
All in favor?
Aye.
Thank you.
Item 18, DLS recommends reducing funds in fiscal 25 that were unallocated. And so the supplemental budget reduces these funds, and so we would instead recommend you reject this item.
Thank you. Move to reject.
Second.
All in favor?
Aye.
Thank you.
And then item 19, DLS recommends reducing the fiscal 25 deficiency to account for the risk corridor recoveries. This was reduced in the supplemental budget, and then the remaining recommendation is to reduce $100 million in general funds. Based on updated information from MDH and the Department of Budget and Management, DLS would revise this recommendation to be $100 million in general funds, and that would be to account for an authorized transfer from the rainy day fund that has not yet been accounted for in the budget.
Got it. Thank you. Move to modify to reduce $100 million for the rainy day fund transfer.
Second.
All in favor?
Aye.
Thank you.
Okay, so then moving to the additional page packet, there's a few items here. On page 9, this first item for your consideration is narrative that would request a report on coverage of end-stage renal dialysis coverage for dual eligible patients.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
And then page 10, the supplemental budget moves funding for biomarker testing from the dedicated purpose account to Medicaid, and the DLS recommendation was to reduce this funding, and so this presents the recommendation to reduce funding for the biomarker testing.
Move to reject.
Second.
All in favor?
Aye.
Thank you.
So that completes the Medicaid items. Back to the decision document. On page 30, under the Health Regulatory Commissions, DLS recommends concurring with the governor's allowance. The agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 31 for DHS administration, DLS recommendation is to adopt a committee narrative requesting a report on the cost implementation progress and long-term sustainability of MD-Think. The agency concurred in part. The agency requested to change the due date to December 1st, 2025.
Thank you. Move to modify due date to December 1st, 2025.
Second.
All in favor?
Aye.
Thank you.
This administration starts on page 33 of the white packet. The recommendation 1 restricts funds pending submission of a report on child welfare caseloads and caseworkers needed to meet Child Welfare League of America standards. The agency concurred with the recommendation.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
I'll be presenting recommendation 2 and 3 together. Recommendation 2 on page 35 restricts funds pending submission of a report on hospital stays by children and youth in out-of-home placements. Recommendation 3 on page 36 restricts funds pending submission of a report on hotel stays by children and youth in out-of-home placements. Page 11 on the additional pages combines these two recommendations. The agency requested these two reports be merged together with a due date of December 1, 2025.
Thank you. Move to adopt the additional page that combines both recommendations and modifies the due date to December 1st, 2025.
Second.
All in favor?
Aye.
Thank you.
Back to the white packet, recommendation 4 on page 37 restricts funds pending submission of managing for results data for fiscal 2024 and 2025. The agency concurred with the recommendation.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 5 on page 38 is a committee narrative requesting an update on the implementation of provisions of the Federal Family First Prevention Services Act. The agency concurs with the recommendation.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 6 on page 39 is a committee narrative requesting report on child fatalities. The agency disagreed with the recommendation. The agency requests, if the report is required, the due date be January 7, 2026.
Thank you. Move to modify the due date to January 7th, 2026.
Second.
All in favor?
Aye.
Thank you.
Recommendation 7 on page 40 is a language that restricts general fund appropriated for foster care maintenance payments to that use only. The agency concurred with the recommendation.
Thank you. Move to adopt.
Second.
All in favor? Aye. Thank you.
Recommendation 8 reduces funds within foster care maintenance payment program. This reduction is associated with 5% rate reduction for institutional providers. The agency disagreed with the recommendation.
Move to reject.
Second.
All in favor?
Aye.
Thank you.
Recommendation 9 requests report on out-of-home placement of children and youth. The agency disagreed.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 10 on page 41 is a committee narrative requesting a report on second phase of the foster care rate reform. The agency concurs with the recommendation.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 11 on page
Page 42, requests data on the cost associated with placing youths in out-of-home placements in hotels. The agency concurs with the recommendation. There is a modification to this recommendation on page 13 of the blue packet, clarifying the data should be provided as a sub-program within foster care maintenance payments.
Thank you. Move to adopt as modified by the additional page.
Second.
All in favor?
Aye.
Thank you.
Recommendation 11 is an annual language restricting general funds appropriated for child welfare services program to that use only or for transfer to foster care maintenance payments. The agency concurs with the recommendation.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 13 on page 43 is a language restricting general funds appropriated for foster care maintenance payments deficiency to that use only. The agency concurs with the recommendation.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
We have one more additional item on page 14 of the blue packet, which restricts funds in DHS and MDH pending submission of a report providing updates on the State Child Fatality Review Team.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
For DHS Child Support Administration on page 44 of the white packet, the DLS recommendation is to adopt committee narrative requesting child support performance reports. The agency concurred in part and requested to change the due dates of the reports.
Thank you. Move to modify due dates to September 15th, 2025, December 15th, 2025, and February 28th, 2026.
Second.
All in favor?
Aye.
Thank you.
On page 46, this starts the Family Investment Administration. Recommendation 1 was to restrict funds in the Office of the Secretary pending submission of fiscal 2025 closeout information. The agency concurred in part.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 2 on page 47 restricts funds in the Assistance Payments Program to be used only for that purpose. The agency disagreed.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 3 on page 48 reduces the administrative funding for the Sunbucks program based on their current staffing levels and vacancy savings across the administration. The agency disagreed.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 4 on page 48 and recommendation 12 later on are two parts of the same recommendation. So recommendation 4 deletes the rest of the administrative funding for the Sunbucks program and then adds the funding to an administrative program, and the agency concurred.
Great. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 5 reduces funding for the Public Assistance to Adults program to better reflect the current caseload, and the agency disagreed.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 6 reduces funds in the SNAP program based on the caseload levels, and the agency disagreed.
Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 7 on page 49 and continuing on to page 50 is committee narrative requesting a report on Sunbucks participation and administration. The agency concurred in part, requesting a December 1 due date.
Thank you. Move to modify the due date to December 1st, 2025.
Second.
All in favor? Thank you.
On page 50, recommendation 8 is language that restricts funds pending the resolution of repeat audit findings. The agency disagreed.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
On page 51 and then continuing on to page 52 is language that restricts funds pending a report on application processing times, denial rates, and case closures. The agency concurred.
Move to adopt.
Second.
All in favor? Thank you.
Recommendation 10 on page 53 restricts funds pending submission of information on the status of implementation of the voluntary settlement agreement. The agency concurred in part.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 11 restricts funds for the deficiency appropriation for the temporary disability assistance program to that purpose, and the agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
And recommendation 12 is the second part of the recommendation to add the funds back, and the agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
The Office of Home Energy Program starts at page 56. Recommendation 1 reduces general fund for miscellaneous personal expenses. The agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 2 on page 56 restricts funds pending submission of a report with data on energy assistance application processing times and denial rates. The agency concurred with the recommendation.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 3 on page 57 reduces special and federal fund associated with communication expenses in fiscal 26. The agency concurred in part. DHS requests the federal funds associated with these expenses be provided.
Thank you. Move to modify to provide federal funds.
Second.
All in favor?
Aye.
Thank you.
Recommendation 4, starting on page 57, 23 million of the fiscal 26 allowance was leveled as an expense for call center. The agency reported it was an error and the funds were meant for energy assistance benefits. This language restricts the use of the fund for the intended purpose. The agency concurred.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you.
Recommendation 5 on page 58 requests MFR data for fiscal 24 and 25. The agency concurred in part. They request the fiscal year reporting interval be federal fiscal year instead of state fiscal year.
Thank you. Move to modify to the federal fiscal year reporting interval.
Second.
All in favor?
Aye.
Thank you.
Recommendation 6 reduces special and federal funds associated with communication expenses in fiscal 25. The agency concurred in part. They request the federal funds associated with the expense be provided.
Thank you. Move to modify to provide federal funds.
Second.
All in favor?
Aye.
Thank you.
On page 59 for the Department of Housing and Community Development, the recommendation recommends reducing by 1 new position, and the agency disagrees with this recommendation.
Thank you. Move to adopt.
Second.
All in favor?
Aye.
Thank you. Sorry. Move to adopt the entirety of the report. Is that the language? All in favor?
Aye.
Thank you. I'm laughing because some of you might recall last year, I didn't know what I was supposed to say, and I said move to adopt the whole enchilada. And so our wonderful committee counsel, Joe, just shared with me a picture of enchiladas to remind me. That's why I'm laughing. We have fun in here. Thank you all thank you DLS for your incredible work and partnership. Thank you subcommittee members. The subcommittee, I really appreciate it. And thank you advocates for your engagement. This subcommittee is now adjourned. There we go.